The fall season isn't just a good time to change your wardrobe. Your beauty routine and medicine cabinet probably need an update too. Joining us now to share some simple updates to our daily regimen that will keep you glowing this season is dermatologist Dr. Vince Bertucci. Good morning.
Good morning, Ivy. How are you doing?
Okay, so what's the best thing we should do to keep our skin clear and healthy year-round?
So I think number one, it's really important to recognize that even though we're moving from summer into fall and winter, that sunscreen is still important. Use that SPF 30 or greater with UVA and UVB protection to reduce that sun damage, that freckling, that wrinkling, and even, of course, to prevent skin cancer, which is really important. That's really important. Other things that you might want to consider are, with the drier winter weather here in Canada, definitely have to think about moisture. You know, if we wash our hands repeatedly, we're going to dry them out. And even if you don't wash, just our environment, our buildings tend to be very dry. So use a moisturizer that's got ceramides in it, for example. They help to restore the barrier function of the skin. So that's really important. And then, you know, one of the other things we often get asked about this time of the year is, you know, they're starting to come up with the holidays, you know, Thanksgiving, the Christmas holidays, and people are saying, what can I do to rejuvenate myself? And fillers is one of the big trends that we're seeing. There's all sorts of new trends and new treatments that we're offering in the office these days.
Now, you talk about fillers. Can you tell me a little bit more about that?
Sure. So we use different types of fillers in the office. We use hyaluronic acid, we use polyl-lactic acid, and we use Radiesse. So things like Radiesse, for example, what they do is they help to restore lift and volume. So you can see in this particular image, this is Carol. She's 49 years of age from Brampton, and she just looks great, but she looks a little bit tired perhaps, has some shadowing along the folds between the nose and the corner of the mouth, and also just below the corners of the mouth, a little bit sad in that area, and a little bit of hollowing just under her cheeks. Her jawline is good, but not perfect. So what she did is she had treatments done with fillers, with Radiesse in particular, and those areas were all addressed to give her that natural lift and volume and shape that makes her look like herself, but just like the refreshed, revitalized her. The great thing about the product is that it induces your own body's natural collagen, and you get roughly 12 plus months of longevity from the treatment.
Now, I want to go back to when you mentioned SPF 30. I usually see 15 in the stores. Why would you recommend 30?
Because if you look at the absorption spectrum and the protection spectrum, let's say, of sunscreens, one of the things that happens is once you start to get below 30, the numbers start to drop off a little bit. And in real life, a 30, you probably have to divide that number by 3 to 5 to get the true SPF. And that's because we don't apply it enough, frequently enough, or we wipe it off by sweating, washing it off, drying it off when we go swimming. So really a 30 in the real world, because no one does it perfectly, in the real world it's perhaps more like a 10, an 8, a 5, a 6. So having that extra protection is great. If you use a 15, you're going to be really low once you factor in real world circumstances.
When is the right time to begin seeing a dermatologist?
You know, we all age very differently, and I think, you know, there are many different factors. Genetics, there's smoking, there's weight changes, there are hormonal changes, and we're just all different. So I think we really need to look at our own individual circumstances, and it could be anywhere from the 20s all the way down to the 60s, 70s, or 80s. It really varies from individual to individual. Of course, if you've got a skin condition, that could be at any age. You could be an infant, for that matter, to see a dermatologist.
And how should we go about selecting a dermatologist? How do you know who's good and who's not?
That's always a challenge, and I think really word of mouth is really important. Get a recommendation from a family or a friend or a colleague, and someone that you trust and that's had a great experience already. And I think it's really important because, you know, just because you inject one product, for example, in one individual and one doctor does it, doesn't mean it's going to look the same when someone else does it. So really expertise in the specific area that you're interested in is key. You could check out, for example, Dermatology.ca, talks about what we as dermatologists do, and it gives you some bios on some of the dermatologists. Our website has lots of information on these procedures in general. That's Bertuccimedspa.avi.
What are some of the new treatments available in your office to help patients look younger?
One of the things that we're doing, as I said, is doing this whole volume and lift. So we're no longer just looking at individual lines. We're looking at facial shaping and contouring so that we can restore the shape and the volume that time has taken away. So classic areas would be the cheeks in here, the folds, the chin area, this region out in here, and of course the jawline. So what we're doing is we're using things like Radiesse, which gives lift and volume and fill to recreate those pleasing, aesthetically pleasing shapes.
Now, you mentioned dermatology.com previously. Where can we go for more information?
So there's a few different websites. For dermatologists, you can look at dermatology.ca. For Radies, you can go to radies.com. And for just general information about some of the things that are offered and out there, you can check out our own website, Bertuccimedspa.avi, all one word.
Thank you so much for speaking with me this morning, Dr. Vince Bertucci. It's been great learning from you about all the things we should do to take care of our skin.
Thanks for having me.
Thank you.
Take care.